Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Meniere's disease. Introduction. Meniere's disease is a syndrome that affects the ears. It causes attacks of symptoms related to hearing and balance. Learning about Meniere's disease can help you understand how to lessen symptoms and what treatment options are available. This program explains Meniere's disease. It also talks about the symptoms, causes, diagnosis, and treatment of the disease. The inner ear. The ear has three parts. 1. The outer ear. 2. The middle ear. 3. The inner ear. The outer ear includes the auricle and the ear canal. The ear canal goes inside to the eardrum. The medical term for eardrum is tympanic membrane. The middle ear is made of three small bones called the ossicles. The inner ear contains the cochlea. Our eardrums help us hear. Sound waves enter the ear canal and make the eardrum vibrate. When the eardrum, or tympanic membrane, vibrates, the three small bones of the middle ear also vibrate and send the vibration to the inner ear. Vibrations sent to the inner ear are sent to the cochlea, an organ in the inner ear. The cochlea has a snail-like shape. It changes the vibrations into electrical signals. A nerve in the inner ear called the eighth nerve carries the signals to the brain. The brain understands the signals as sounds. A section of the inner ear as well as the eighth nerve are responsible for balance. This is why hearing problems and balance problems many times happen at the same time. The semicircular canals are small tubes in your inner ear. They affect your sense of balance. These tubes send signals to the brain. The signals affect the way the brain controls the body. Symptoms. Meniere's disease is a syndrome that affects the ears. It causes attacks of symptoms related to hearing and balance. A syndrome is a group of symptoms that happen together. Meniere's disease can affect one or both ears. Meniere's disease can cause ear pain, hearing loss that comes and goes, and tinnitus. Tinnitus is a roaring, ringing, or hissing sound in your ears.
Meniere's disease can also cause vertigo. Vertigo is a severe dizziness that can make you feel like the room is spinning or whirling. Vertigo attacks happen quickly. They may last a few minutes, hours, or up to a day. Severe vertigo can cause nausea and vomiting. Meniere's disease can cause loss of hearing. People with the disease often find it hard to hear sounds that are low or high in pitch. This loss of hearing may return to normal after the attack, but it may become permanent. Meniere's disease can also cause a feeling of pressure or pain in the ear. A person with Meniere's disease may know that an attack is about to happen based on certain signs. Signs may include a feeling of pressure in the ear that gets stronger, nausea or vomiting, sounds seeming louder than normal. Attacks tend to happen a lot in the first few years of the disease. As time goes by, they happen less often. Each attack may cause damage to the inner ear. Over time, the inner ear may be so badly damaged that it may not work properly. The attacks may then stop, but may cause permanent balance problems. Hearing loss, roaring or hissing in the ear. A few people with Meniere's disease experience drop attacks. A drop attack is a sudden fall while standing or walking. The falls happen with no warning. The person may feel like they have been pushed to the ground. Drop attacks do not cause a person to lose consciousness. They usually feel normal again in a few seconds or minutes.
Sponsored by the Patient Education Institute. www.patient-education.com.
over 5,000 videos and interactive tutorials.
Causes. The cause of Meniere's disease is not yet known. Scientists think that it may be caused by a fluid imbalance in the inner ear. The inner ear contains a fluid called endolymph. A person with the disease may have too much of this fluid in their ear. This causes a buildup of pressure. The pressure affects the part of the ear that helps you hear and maintain your balance. Meniere's disease often happens in people ages 40 to 60. Children can also have the disease. It affects both men and women. It is hard to predict who will get Meniere's disease. You may be at risk if you have a family member with the disease, an autoimmune disease such as type 1 diabetes, lupus, or rheumatoid arthritis, allergies, had a head or ear injury, had a viral infection of the inner ear. Because some cases may be caused by head injuries, wearing a helmet can help protect you. Wear a helmet when you ride a bicycle or play sports. Diagnosis. To diagnose the disease, your doctor will do a physical exam. He or she will ask you questions about your past health. A hearing test may be done to detect loss of hearing. A type of hearing test called an auditory brainstem response, ABR test, may be done. This test can find out whether the nerve from the inner ear to the brain is working correctly. Other tests, such as an MRI, may also be done. An MRI, or magnetic resonance imaging, is a procedure in which a computer takes pictures of areas inside the body.
There are a variety of other diagnostic tests that may be done. Sometimes blood or imaging tests can rule out other possibilities before making the diagnosis.
Treatment.
There is no cure for Meniere's disease. Treatment can help you control your symptoms. A balance rehabilitation program or hearing aids could help.
Medicines may be able to reduce the spinning feeling caused by vertigo. They can also reduce the nausea and vomiting. You may be able to reduce the symptoms during an attack if you lie down and hold your head still. Some people may be able to have fewer attacks if they avoid stress, do exercises to improve balance, do not use caffeine, alcohol, or tobacco.
Eat a diet that is low in salt. This may slow down fluid buildup in the ear. Take sedatives or antihistamines to soothe the inner ear. Use medicines, known as diuretics, to get rid of extra fluid in the ear. Sometimes, healthcare providers will inject antibiotics or corticosteroids into the ear. Certain antibiotics may increase the risk of hearing loss. The risk of hearing loss is lower with corticosteroids, but they may not be effective for every patient.
A tube that is surgically implanted in the tympanic membrane may be used. You can use a handheld gadget known as a Meniere device to control the tube and send small pulses of pressure into your middle ear.
The pulses of pressure remove the fluid buildup in your inner ear. This may restore your sense of balance. Some studies show that the device can reduce symptoms of vertigo. The long-term effectiveness of this treatment is not known, so not all insurance companies cover it.
When other treatments do not work, other surgeries may be recommended. These may damage your hearing or cause total loss of hearing. Surgery for Meniere's disease may be an option if you have frequent and severe attacks that do not improve after using medicine, severe symptoms that get in the way of your daily life, symptoms only in one ear. Complications. If you have been diagnosed with Meniere's disease, watch closely for changes in your health. Contact your healthcare provider if severe or frequent vertigo attacks get in the way of your daily life, you have any new symptoms, you have problems with your medicine, you have questions or concerns. Seek emergency medical care if you experience both vertigo and changes in vision, chest pain, symptoms of a stroke, you pass out, you are not able to use or understand speech, vomiting that does not stop.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Meniere's disease is a syndrome that affects the ears. It causes attacks of symptoms related to hearing and balance. It can cause ear pain, hearing loss that comes and goes, and tinnitus. Tinnitus is a roaring, ringing, or hissing sound in your ears. Meniere's disease can also cause vertigo. Vertigo is a severe dizziness that can make you feel like the room is spinning or whirling. Vertigo attacks happen quickly. They may last a few minutes, hours, or days. Severe vertigo can cause nausea and vomiting.
The cause of Meniere's disease is not yet known. Scientists think that it may be caused by a fluid imbalance in the inner ear.
If you have been diagnosed with Meniere's disease, watch closely for changes in your health. Seek emergency medical care if you experience both vertigo and changes in vision, chest pain, symptoms of a stroke. You pass out. You are not able to use or understand speech. Vomiting that does not stop.
Treatment can help you control symptoms of Meniere's disease. Medicines may help. Other treatment options include lifestyle changes, a balance rehabilitation program, hearing aids, or surgery. Thank you for using Explain.